This is Sean Huang with Psychiatry. Today we'll be talking about the comorbidity problem in psychiatry. So let's break it down and explore the clinical impact of this issue. In psychiatry, comorbidity refers to the presence of multiple mental health conditions in a single individual. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, is the primary psychiatric reference for many clinicians. Within the system, all diagnoses are treated equally, and clinicians are encouraged to identify as many disorders as possible. This approach often leads to situations where patients are prescribed multiple medications for multiple disorders, a practice known as polypharmacy. A main task of clinicians is to differentiate a disease from the normal state through accurate diagnosing. Since the DSM-3, the standard approach has been to use diagnostic thresholds. The idea is that as symptoms or dysfunctions increase in severity, a cutoff point will help differentiate those who should be diagnosed from those who should not. This approach is intended to address the false positive identification of disorders. The DSM now also applies a symptom-function approach. That is to say, more severe symptoms with functional impairment have higher priority diagnostically than milder symptoms. A common example arises when a patient presents to the clinic with symptoms of both depression and anxiety, which is a very common occurrence, by the way. If the patient has more severe depressive symptoms, the clinician tends to diagnose depression as the primary psychiatric disorder, and vice versa. Here are a couple examples illustrating limitations in the symptom-function approach in psychiatric diagnosing. For instance, when a patient emphasizes insomnia as severe, depressive symptoms may be missed. When a patient emphasizes inattention symptoms and not the decreased need for sleep, manic symptoms may be missed. Originally, comorbidity was used to describe two independent and separate diseases. In psychiatry, however, the concept of disease has been replaced by disorder. This shift means that comorbidity often reflects overlapping symptom presentations in different DSM-defined disorders, which may indicate the same underlying disease and sometimes no disease. One of the direct consequences of the DSM approach to comorbidities is polypharmacy. Patients with multiple diagnoses often receive multiple medications, one for each diagnosis. This can lead to increased adverse effects, drug interactions, and overall complexity in pharmacologic management. What could be another approach to psychiatric diagnosis? A diagnostic hierarchy could be implemented where some diagnoses are subsumed under others based on their underlying cause. The general principle is that polysymptomatic illnesses should be ruled out first. This hierarchy would prioritize the ruling out of affective disorders, followed by psychotic disorders, then anxiety disorders, and finally other conditions like personality and inattention disorders. An example of how this would work: affective disorders, psychotic disorders, and anxiety disorders can all cause attentional issues. However, ADD would not cause mood, anxiety, or psychotic disorders. Now, even within a group in the hierarchy, different illnesses would be higher up on the hierarchy than others. For instance, unipolar depression would be a diagnosis of exclusion relative to bipolar disorder. That is to say, only if bipolar disorder is first ruled out would unipolar depression be possible to diagnose. The diagnostic hierarchy approach could lead to more effective treatments. For instance, when patients with bipolar disorder are treated with mood stabilizers, the associated anxiety and inattention symptoms tend to improve. When not using the diagnostic hierarchy approach, patients with bipolar disorder may receive antidepressants for anxiety symptoms and amphetamines for inattention symptoms. Both classes of medications are known to increase the risk for developing mania. In conclusion, the comorbidity problem in psychiatry presents a complex challenge, influencing how mental health conditions are diagnosed and treated. Both the threshold and symptom function approaches contribute to this complexity. By adopting a diagnostic hierarchy approach, the accuracy of diagnoses can be enhanced and more targeted treatments facilitated. Thank you for watching.